The University of New Mexico Sandoval Regional Medical Center, located in Rio Rancho, is the community's newest and best source for comprehensive health care. The 200,000 square foot facility will support unique clinical and educational initiatives in a state-of-the-art community hospital setting. And I'm pleased to say that joining me this morning with details about the Sandoval Regional Medical Center are Vice President of Patient Care Services, Erica Hamilton. Good morning, Erica.
Good morning.
And also joining us, Radiology Dr. Brad Cushnyr. So happy to have you, Doctor.
Thank you.
Thank you so much for being here. And I want to tell our viewers first, what sets the quality of care and service at the medical center really apart from all other hospitals?
Well, we have a very unique relationship with the University of New Mexico, and that's our biggest advantage.
Yeah.
For instance, in my department of radiology, I have access to over 30 of the best trained radiologists in the country.
Wow.
So most community hospitals don't have that kind of access or advantage, and that's a big thing for us.
That's a very big thing, and it gives patients a lot of comfort to know that you're really scouting the best of the country, the best of the nation right here in New Mexico. And
absolutely.
That makes us feel good. And the medical center is really cutting edge, and I think that's also something that's really cool. It's still growing as well. So what are some of the services that are available to the patients right now?
Right now we have imaging services, emergency services, general surgery.
Okay.
We also have, in addition to that, family practice, urology, orthopedics, rheumatology, and it seems like almost every day we're adding something new to that.
Well, and I'm glad you're here to talk about it, because I don't think people are even aware of just how much you do. And I know there are still some services that are still to come that we don't even have just yet. So can you tell me some of the things we can look forward to?
Well, I would just say that as we grow, we're going to continue to add services that match what our community is telling us they need.
And listening to the people is everything, and being able to follow through on that. So tell us about some of the innovative equipment at the medical center, because I know that's another standout for both of you, right?
Well, it's particularly important for my department in radiology. For instance, we have a brand new state-of-the-art women's imaging center, which we're very proud of.
Yes.
I think we were able to show some pictures of our mammography suites, which are brand new and feature special lighting system that allows the patient to tailor the environment to suit their needs.
What are we looking at right now?
That actually is part of our imaging suite, and that's our tomosynthesis machine. So one of the things we're also very excited about is our advanced breast imaging. For years, mammography was standard 2 views. We saw 2 views of the breast, but now we have the ability to actually image the breast in 3 dimensions. And this is very important because it allows us to diagnose the breast disease better and prevent false positives, which is something we're really excited about.
No kidding. I mean, we recently actually talked on this show about the 3D mammography. So what is the hospital's vision and the goal for the women's imaging department? Because I know we're looking a little bit at some of that innovative equipment. What's the goal from here forward?
To put it very simply, to take something that's typically a really scary experience for a woman and to turn it into something they can almost look forward to.
Really?
Yes, as you could see there in those pictures earlier, the special lighting in the rooms, we can make those rooms any color. So if you have a preferred color, like pink's your favorite color, we can make the room that color.
You know, like you said, anything you can do to make that experience a more pleasant one, and especially, obviously, a more thorough one, because at the end of the day, all we want is our health. And we've also been hearing a lot in the media lately about low-dose technology. Do you offer that, and why is it important?
We do, and actually we have the most advanced CT scanners in the state.
Really?
Our CT scanners are brand new Philips machines that were built from the ground up with the idea of low dose. And they have special software and computers in them that allow us to use less radiation on the patient and yet get the same quality of images we used to get in the higher dose machines. So very, very big advantage for our patients.
Yeah, that's so good to know. And in addition to everything you do for your patients, the medical center also serves as a teaching hospital. So I'd love for our viewers to know those details as well.
Well, what that means is very soon we will have students there from every healthcare discipline, from nursing, pharmacy, physical therapy, to medical students.
How nice is that? You know, and I always talk so much about the economy and how tough it is to get a job, but at the end of the day, we all are always going to need our doctors and our nurses and our medical care. And so it's a wonderful industry to get into, to know that you're teaching something in addition to helping is a nice positive. And I know a lot of people out there watching are thinking, okay, this is all great, but I am having some issues in the economy right now. Do you accept insurance?
Yes, we accept almost every insurance.
good. Okay.
And by the end of August, I would say probably 90% of what's available here in town for insurance products we will be accepting.
Oh, that's fabulous. Oh, that's a nice breathing sigh of relief, right? How can our viewers take advantage of the services at the medical center? Do they have to be referred by somebody? Do they have to have a personal physician refer them over to you?
Well, that would depend on which service that they need.
Okay, okay.
If it's a radiology study, most of those do need a referral, except for mammography.
Except for mammography.
That is
The
the one
patient
thing.
can request her own mammogram without a doctor.
Oh, that's fantastic. Okay, good to know. And I know our viewers also will want to understand how they can get in touch with you, how they can find out more information about the Sandoval Regional Medical Center. So let's give them some of those details, shall we?
So if they have any questions, they can find us on the web at unmsrmc.org or by calling us at 505-994-7000.
Easy enough. Well, I thank you both so much for all that you're doing. And like I said, in addition to everything else we talk about, nothing comes before our health. And we appreciate you being there for us.
Thank you for having us.
Thank you. And you don't want to go away, because coming up next on New Mexico Style, one of my favorite things, shop till you drop for less. Even better.